Good morning. Welcome to the Judy and Bill Show, otherwise known as Viewpoint.
Otherwise known as the Bill and Judy Show.
Always give her top billing, Gaileh. You know.
No, that's not right. It is Bill and Judy. That means you're top.
Well, anyway, that's highly rated, vaunted, most listened to talk show, the high Nielsen ratings.
And both people like it.
All of you out there will stand on every word. You may recall, Gaileh, that we always try to start Viewpoint with a kudo or two. Today, we're going to go an advanced kudo. There's a little cemetery over Mount Pulaski called Steenbergen. And it's a pretty place in and of itself. But on Memorial Day, they have the Avenue of Flags. And it's just gorgeous.
Yeah.
And there's a lot of people. There are a lot of people. There is. You remember my grammar teacher wouldn't like that. There are a lot of people over there who do a lot of work. So big kudos to them. As a matter of fact, I thought maybe if you're scheduled, well, we might just drive over there Memorial Day and take that in, take a look at it. They do a nice job.
I think that would be a nice thing.
There's some great people over there in Vinegar.
You want me to take my dog?
No. Judy has a lovely dog.
No, I haven't. He's a waste of fur.
The dog has a problem barking, and that probably is spelled incessantly.
Jim, you vouch for that.
All right, let's get down to serious business. We have a lady who has given us her time today to talk about a very, very important subject, more so in my case now than it used to be. Go right ahead.
I think you should say more so in our case. Gaileh Barrow is with CareLink, and they have rather an extensive network of care for people who can get by in their homes for longer. That being an important part of your job, isn't it?
Yes, absolutely.
That's got to be a godsend to people who fall under that mantle.
Yes, and our mission is to keep folks independent and healthy as long as possible. Now, we do go into the home, but we can also go into an assisted living facility, independent living, retirement. We've even had family members reach out to us to sit with their loved ones in skilled nursing facilities, to be a supplement to current hospice care, to go in and have that extra. We've gone in alongside home health that will go in. So there's a lot of gaps we can fill. There's just a few things that set CareLink apart. We're the only home care that's per se nurse guided. And what I mean by that is our nurse is in on the hiring. We do extensive background checks, the whole 9 yards, but she's in on the hiring process. Does very in-depth training, hands-on training. I watched her train the caregivers, and it's just so in-depth. She covers everything from infection control to how to transport people in their homes. She trains them on using Hoyer lifts, slide boards, the gait belts, how to change Foley bags, how to bathe and dress correctly, infection control when you're cooking in the kitchen, when you're cleaning, just very in-depth what they can and can't do in the home. But that nurse oversight is there all the time. What she does, if folks say, hey, I just want to talk, she'll come out and do a free information visit. There's no obligation, there's no charge, nothing like that. She'll come out and see what that individual's needs might be, whether it's something simple like laundry, cleaning, cooking. They might just need somebody to come in and do those things. But they might be recovering from an illness or recovering from a surgical procedure or something more in depth like that. And she'll go in and just do an assessment and see what their needs are. And then if they do want services, she recommends, how much they might need, just a few hours a day or a few hours a week.
Kind of a sliding scale, so to speak, as far as needs.
Yeah, she kind of determines that, and she'll give her advice, and she's ethical in her advice. She won't tell you need more than you need. She will be honest with that. And then if they do decide that they want our services, she develops a care plan for that individual's needs and assigns that caregiver appropriately, you know, to make it a match and to make sure their skill sets fit what that person might need. Like if that person is suffering from the symptom of dementia a little bit, she might grab Marcy over here that's had experience with that, you know, this caregiver. Or she's just very meticulous in her approach to the care. We are nonprofit and we are faith-based, of course, because we fall under Christian Horizons umbrella. Doesn't mean you have to be Christian to get our services. I have surprisingly been asked that question.
Yeah.
It just kind of determines the ethical standards that we live by, the compassionate care that we provide to folks. That's what that means. And we're also, what a lot of folks get confused on, we're also Joint Commission accredited. There's not, I have searched and searched, I can't find other home cares that have that. So we've kind of gone the extra mile to get that because it's not mandatory that you do the Joint Commission accreditation. A lot of your hospitals and bigger organizations have that.
Yeah,
it's
Joint Commission strikes fear in the hearts of men at hospitals, let me tell you.
Yeah, and it's just an extra step that you seek. You know, you go to them and say, hey, we want this accreditation, and what they do is they come in and check those care plans that the nurse puts together. They check the documentation. They check, you know, whether there's quality and safety involved in the care. They will go in and watch the caregiver do the services. There's just a whole big area there of oversight that they check as far as quality and safety in the home or wherever they call home. But we serve all ages as well. Most of our clients are older adults over 65, but we will serve any age. You know, there's people under 65 that will have, you know, heart surgery or break a leg or break a foot or have hernia repair, or, you know, anything like that, or an illness, you know, that might require someone to come in and give them a little bit of help. New moms. You know, we can go in and help new moms. We can go in before they become a mom if they've been put on bed rest. You know, they can't get up and be doing the laundry and the cooking and the cleaning, so we can come in and help them there.
Well, you know,
or
that
after
would
the baby.
be a wonderful service for someone. I didn't even think about that.
Yeah, and when people think of home care, they think of older adults.
Sure.
Well,
Yeah,
sure,
and like I
obviously.
say, the majority of our clients are, but we do serve everyone because there's needs out there. People are at home going, you know, what am I going to do? My spouse is at work all day. How am I going to get to the bathroom? How am I going to bathe? How am I going to get my lunch? You know, there's a lot of those questions. You know, they can go out and get your prescriptions picked up for you. They can run errands for you, grocery shop. They can come in and cook meals for the whole week and freeze them for you so that you have those the rest of the week, so that caregiver doesn't have to come in every day necessarily to cook for you. You know, there's things like that they can do to help folks, you know, remain independent and healthy so that they don't get up and try to do things themselves and fall. You know, God forbid you break a hip and you're not at home anymore. You might end up in a skilled nursing facility, you know, because, you know, we've seen that folks that do end up falling and fracturing a hip, most times there's a decline from there. You know, so we want to prevent that from happening. And I try to iterate to folks, you know, it's not shameful to reach out for help. You know, it keeps you home where you're going to be able to call the shots. You know, have your own schedule. You know, eat what you want to eat. Friends and family have more access to you. You can still go to social events when you want to go. Our caregiver can take you anywhere you want to go, whether that be a church or a function. Dialysis. They drive our folks to dialysis appointments. They pick them up from the hospital when they're discharged and don't have a ride and take them home and make sure everything's safe and in place for them. There's just so many instances where they can come in and help. And like I say, we have folks that are in the hospital will be discharged sometimes to home and have home health come in, but they come in only 3 days a week. So there's gaps there. Home health will reach out to us and say, hey, I see Mr. Smith needs a little bit of extra help. Can you come in and do an assessment and see what the needs might be here? So we work alongside hospitals and doctors and all sorts of healthcare entities to make sure that person stays independent. And like I say, we go out to you know, assisted living, independent living, to make sure that they don't have to. We try to prevent and prolong that extended care, where it's more expensive. it's going to cost folks more in the long run to go to an assisted living where they need help. They might not need help all day. They might just need 12 hours a week to stay independent at home, and they can avoid that cost, down the road. So it's just something that we try to help them to stay in there longer. And one of the big things to staying at home, one of the advantages is they're away from contagions. I see so many folks that have been in the hospital and then they come home, or they have to go somewhere and they, develop a staph infection or something. There's something that complicates that care even more. So we want to keep them where they're going to thrive. Most of us would want to stay home, where we're comfortable.
I'm prompted to ask the question. That's as necessary as it is. My goodness, it's necessary. But it's not a very glamorous job for folks. Whence cometh your people who serve your clients?
The caregivers. We have caregivers of all ages, and I got to be honest with you, we don't discriminate on that. A lot of our caregivers that are over 40 are our best caregivers. And we're always looking for great caregivers. You don't have to have certification. We do have some CNAs on staff that have worked in long-term care and have worked with patients, but the training is so in-depth by our clinical staff that when they go into the home, they're equipped to do what they need to do in there. They have to follow that care plan that nurse has set up to the letter. She might put in there, they might have just had heart surgery or heart episode. This is what I want you to look for: nausea, dizziness, shortness of breath. She'll put red flags in there. Let me know if this happens, and I'll be out there to check them. So that oversight, she's there 24/7 for the clients, their families, and those caregivers to reach out to should they have any questions. I see this wound, is looking kind of funky. I'm concerned. Nurse will come out and take a look. We want to stop those things before they progress and they end up in the ER or the hospital again. So it's just a way to keep them where they're at. And we help a lot of folks too that are on waiting lists for independent living or assisted living. A lot of those places are full and they want to get in. We can come in and make sure they stay healthy till they get in where they want to be. They might want to go there and have the socialization, but family members might be afraid they're going to take a tumble before that happens. We can come in and make sure that doesn't happen and keep them healthy till they can go where they want to be, So, and they can make their own decisions. Whoops, excuse me. I don't need it anyway.
Your staffing, how are they compensated? I don't know. I need to know exact numbers because I don't think that's anybody's business.
I don't take care of any of that.
Yeah.
But I do know that they can choose. They're flexible hours. They can choose whether we have some folks that have other jobs, and they do that to supplement their income. Or we've got stay-at-home moms or retirees that want to just have a few hours a week. They might want more hours. I want as many hours as you can give me. Those are the ones that we're going to send out to do their clients that require more hours. We have even 24/7 clients that pay us to come in and live there to make sure they want to stay out of that nursing home at all costs. Some of them, and they'll have us come in and stay there. Some just have a few hours a week that they're happy with, coming in and helping them do things.
Get up in the morning and have their breakfast and shower.
Right, and sometimes they go into assisted living and do that for folks. They might need extra, so we'll come in and work alongside staff in those places to do the extras that they might want or families might want for them, So, and sometimes they just want companionship.
There's a lot of that, isn't there?
Yeah, there is, yeah. A lot of folks are sick at home with chronic illness, and they can't get out much, and they don't have a lot of social contact, So some of them just want somebody to come in and not only help them to do their daily tasks, but they can just come in and be a companion to them, read to them or do activities with them or whatever they need.
Your charges are based, CareLink's charges, not Gaileh's charges, the CareLink's charges are based on the amount of care that you provide for the client.
Yeah, sometimes they just need the supportive services, the caregiver. And another thing that does set us apart is we have skilled nursing services as well. A lot of folks get confused thinking, oh, that's home health. No, we're not home health. We do health in the home, but home health is who comes in after you've been in the hospital or something. It comes into the home to check on you a few times a week. Our skilled nursing services are that is just wide open. They can come in and do wound care, lab draws. They can come in and do safety home checks. They can come in and teach loved ones how to administer insulin, so that someone's not having to come in and do it for them. They can educate. They go out and educate on these things. They go out and educate on, they try to help loved ones to learn how to take care of their own in the home. They'll educate on chronic illnesses like heart disease, arthritis, COPD. So they'll go out and educate. This is what you need to be doing now. This is through your diet, nutrition is important, your rest. She'll educate them and the families on what they should be doing to manage that illness so they can remain where they're at. So there's just different things people reach out to us for. Now the skilled nursing component is a little higher than the caregiver only. Sometimes we have one or the other. We have both.
Really?
It just depends. And the nurses will actually coordinate the doctor's visits too. A lot of folks that have 4 or 5 doctors, she'll be in contact with that doctor and she'll make sure that patient keeps that appointment. And, she can set up the appointments for them. Things like that. There's so many things that she can go in and do. But if they're just having a caregiver, like I say, that nurse oversight is there all the time. She is guiding them every step of the way. I've been with her when caregivers have reached out and asked simple questions. But it's good to ask those questions, to have somebody that you can call that's going to answer that phone and answer your questions so that they can take care of that person properly.
There are tons of people out there, I'm certain, Judith, that are not aware of this type of service being available to us. 648-5510. Gaileh Barrow is our guest today. We're talking about a very, very important part of our final moments, so to speak. Sometimes those are long final moments. What about the case where a person has finally succumbed to a coma, and that's kind of a vegetative state business? You cover that type of care too? Well,
now they would probably qualify for hospice, I would imagine.
Yes.
But yeah, we can go in and supplement. Like I said, we can come in. We work alongside not only our own hospice, but other hospices will reach out to us. They're currently on our hospice. Can you come in and sit with them overnight and make sure this doesn't happen or this? Or our skilled nursing. It just depends on the situation they're in. We're there for pretty much every scenario. We can go in, and if we can't do it, we'll lead them to the resources that can do it. That's another thing. The nurse comes in and does that free information visit. I can't express enough how valuable that visit is, because you're not obligated, you're not charged. She can come in and she'll sit with you as long as you need, and she can look around the home and see safety issues and give you advice on, maybe you should move that piece of furniture there. She'll say, are you paying for that piece of equipment? You don't have to. Medicare will pay for that. She'll tell them who to call to get the ball rolling for this, and this. So she'll give that free advice while she's in the home, even if you don't get services from us. So that info visit is valuable in itself. And people can call our number and you get right to the admissions lady and she'll set that information visit up where that nurse or care coordinator can come out and just talk to you and see, do you need our services or not? And like I say, she'll be honest. So
you talked about educating families, which brings us to the fact that we have to educate our listeners that we have what's known as sponsorships, and therefore we're going to educate the listeners to our various and loyal sponsors. Go ahead, Mr. Ash. Right back in the studios here. The program is Viewpoint, of course, appearing each Wednesday morning, 8:15 to 9 o'clock. One of our super guests we have with us this morning, Gaileh Barrow, talking about a very, very important subject, home care for folks who need just that, care in their homes. Judy, go right ahead, please.
One thing I'd like to ask you about is the fact that people always we all want to be in our home. That's where we're happy. That's our happy place.
Absolutely.
And that's perfectly understandable. But do you find, from a physical standpoint, that people having someone come into their home to help them with the things they need help with, so that they can be there, does that give them a better quality
Oh, definitely.
of life?
The fact that they're able to remain in their home, because a lot of folks get scared to leave the home. They don't want to live somewhere else. They don't want to be forced to live somewhere else because of their physical needs. If they're at home, they're going to thrive because they're in familiar surroundings. They are where they want to stay, and like I said, they can call the shots. You know, many times if they have to go into a facility, you know, their schedule is based on kind of sometimes their schedule. So when you stay at home, you know, you can ask that caregiver to do things for you. You know, this is what I'd like for you to do. And we reach back out to them, too, to make sure that caregiver did what they, you know, asked them to do. We do follow up with that. So they can call the shots, per se. And if they are ill, you know, I don't know. I can speak for myself. If I was sick, I would want to stay at home and have someone come to me rather than have to go somewhere. And it's just a reliance thing, too. I think someone coming into the home, you don't feel like you're relying on a whole team of healthcare specialists.
It doesn't take away all your independence.
No, and you still have that independence. You know, there's some folks that just reach out to us, like, there's simple things, like if you go to the eye doctor, and, you know, a lot of times you have to get your eyes dilated to get them checked.
Yeah.
You can't see for like 3 hours. So we can take you there and we can take you back home, you know, and wait till you get your eyesight back and you can manage. And some folks that say, you know, I still want to drive, but I feel kind of iffy driving. You know, the caregiver can help them with that. They can take them anywhere they want to go. So they don't want to give up their independence. They just need maybe a little bit of help with this, that, or the other. And a lot of times when folks call us to come in and do laundry and cooking and cleaning, sometimes we'll see that there might be an extra need because there's a reason they're reaching out to have those things done.
See, you touched on 3 things that are very, very important in the home: the laundry, cooking, and cleaning. A lot of times that falls by the wayside.
Yeah.
There are some homes where nobody else is available.
Right.
And now let me ask you this. Do you go into homes where the patient is the sole occupant of the home?
Oh, yes.
Do you?
Yes. More so than others, because lots of times, yeah, if they're by themselves, they need our help more than ever.
That's got to be
if
great
not
consolation.
for the physical, but for the emotional and having that companionship. And we all know how the emotional affects the physical.
Sure.
You know, to have somebody to talk to and to help them. Isolation and loneliness, you know, has been proven to make folks decline faster. So we can step in just for that, if they just want somebody there, present.
Do you have a lot of interface with the families?
Oh, yes. We keep in contact with the families a lot. Like I say, we try to educate them. We keep them in the loop. We let them know what's going on. We follow up with them. Keep them very involved. And a lot of families reach out just because they've all pitched in to help their loved ones, but sometimes they need a little rest, but they need a little break. You know, it can be overwhelming for some of them to take care of loved ones, and it's hard for those who live out of state, you know, that can't be there to take care. That's frustrating. But they might have jobs that they have, and they're caring for a loved one at the same time, or they're that sandwich generation where they're taking care of kids still at home, and they've got parents that need help. So they're trying to juggle all that, and it's stressful sometimes, and they can't do it all. So they need that respite for somebody to come in just a few hours a week so they can get a break and do what they need to do for their family or do what they need to do personally, to just get away from that stress so that they can be better caregivers when they are back present with their family, you know. So we can go in and help with that, you know, just to give them a bit of a break.
This is an all-encompassing service, for want of a better word, for families.
We cover a lot.
Who have a need for that. 648-5510. There might be somebody out there that is in a situation they just don't know what the heck to do. And if nothing else, perhaps you can give them advice and make them feel better.
Yeah.
Without even worrying about signing. Now, you have your service. You have to get compensated for your services, and it's according to the care and the service that you're giving. How is that done, Gaileh?
Well, they determine that. That coordination team determines that. And we have like minimums. Like we have a 3-hour minimum so that our caregivers aren't going, from Lincoln to Bloomington they're not driving all over.
Spend all their time on the road.
Yeah, but sometimes folks, will need 4 hours a day, but they need that split up. If they're in that area, we can certainly do that. 2 hours in the morning and 2 hours in the evening.
Really?
Help them get up, help
Isn't
them
it
get
tough
to bed.
to find staff members that fill those time
No, because
niches?
we have people geographically aligned in the counties that we're licensed in.
It's amazing.
Yeah, and our supportive services are licensed as well as our nursing services, so that's another thing that sets us apart. That licensing is huge.
Licensed by the state of Illinois?
Yeah. So, but yeah, we have caregivers aligned in these areas so that they're not driving an hour or 2 hours. They're set up in different places so that they're close to those clients that need help. So we can call them out and say, hey, so-and-so over here 20 minutes from you needs help. Or they might be right in Lincoln. We've got a lot of caregivers that live right here in Lincoln or close by.
Now, are there other sources of funds to help other than private pay?
There are a lot of folks. Now, one of the things that they do get reimbursed, a lot of folks buy the long-term care policies years back and forget they have them.
Yeah.
So I always tell them, look to see if you have one, because they will reimburse for home care. Up to, it used to be $250, but now I hear it's higher per day. They'll reimburse for that. Also, for those folks that are low income, we do participate in Medicaid CCP program. We will send them on to CCP, and they'll make sure that they get care. We are
CCP.
contracted with them. Community Care Program.
Okay.
Yeah. And so we do participate in that. And the girls at the office will tell you who to call and lead you in the right direction for that. So we do participate in that if there's a need and folks just can't afford it at all. But I do try to tell folks the value of it is if you compare those few hours a week to an assisted living or skilled nursing, there's no comparison.
You can't compare.
You can't. It's
No.
really, you can't. People go, oh, I can't afford that. Well, but it decreases your copays, your deductibles, your $3,000 to $7,000 a month fee for assisted living. You might not need that 24/7 care. You might only need 12 hours a week, and that's so much more affordable for folks. So that's something that we try to relate to them. You need to do a comparison, and when you do explain that to them, then they're like, oh, okay,
You mentioned background checks. I'm sure that the people that you're serving are very interested that be the case.
Yes. And I'm glad you brought that up, Judy, because a lot of folks will go out and get a private caregiver, which I don't have anything against private caregivers. I used to be one myself. I would have never dreamed of doing anything against the folks I was taking care of.
Well, no.
Nowadays, you're not quite sure who you're going to get walk through that door.
Exactly.
You can't do the background check. We do all that for you so that you don't have to worry and you have peace of mind when we walk through the door with all of the oversight we have in place. But I try to tell folks, okay, when you hire a private caregiver, you are that employer. You're responsible for Social Security taxes, employment taxes. If they get hurt in the home, you're paying all those medical bills. Now, not to say that they're going to make you pay those for them, that the caregiver's not going to be that kind of person. But you take that risk if you get somebody that comes in and that relationship ends badly, they can come back and ask for all that legally and get it. So that's something to think about. If it's somebody that the family knows real well, you don't have to worry about that most times. But that's just something I try to let folks know that risk is there. Not that it's going to happen to you, but it is there. It's safer to go with a licensed agency. And a lot of times with that reimbursement issue, Bill, you mentioned that, they require accreditation, that Joint Commission accreditation. They want to make sure that care is safe and quality care. They're not going to reimburse just for any kind of care that's out there. They want to make sure you've taken those extra steps and gone above and beyond to make sure that care does have oversight.
Then there's a practical matter which applies to anybody in your home, and of course, valuables
Yes.
that are around for the picking, so to speak.
And that's a fear for a lot of folks.
And that's a valid, particularly today, unfortunately.
Yeah. Well, now say a caregiver comes in, this private caregiver, and breaks an expensive lamp. Well, that happens with one of our caregivers. We're bonded and insured. That's covered. Don't have to worry about it.
Oh, and
that's
that
covered.
could happen to anybody.
Yeah, when they're cleaning or something
Sure.
could happen like that.
Judy
but,
checks her jewelry when I leave the house.
yeah, yeah.
If I had it.
And that is, it's hard for folks to say, you know, I want somebody to come in my home and help. And that's why we've taken the extra steps to make sure that oversight is there, that they are watched. And that oversight is huge. Like I said, our nurse and our care coordinators will reach back out to family and say, were you happy with the care? Were there any problems? And the client themselves, you know, is this a match? Because we can, you know, give them another caregiver. That's another thing when you hire a private caregiver. What if she gets sick? Who's the backup? If you're recovering or something, you need somebody in there. Who's going to be her backup if she's sick or goes on vacation? You know, so there's just things to weigh there. The benefits of using licensed and insured and accredited agency is huge.
Now, the person who comes and does this initial overview interview, do they then kind of assess the prospective client's personality?
Oh, yes, definitely.
So that you have a compatibility?
Good point, Judy. Very good point. Yes, they do.
Well, she's better than a bright bulb, I'll tell you that.
And she, you know, and our nurse care coordinator has been doing this for years, and she's a pro. She has that you know, insight into how to match those caregivers up to match that personality. She's just great at that. And if for some reason they say, you know, can I try another one? I don't see it very often, but, you know, can we try another one because, you know, something might not fit there? And they're fine with that. And caregiver doesn't feel bad. It just might not be a fit. But she tries very hard initially to, a lot of times she'll take that caregiver in and just have them sit and converse with them before they ever pick that one. Is this a fit? Okay, well, would you like for us to keep this caregiver for you? Would you like to have her? So she might go out and introduce them to the caregiver. You know, this is the lady that might be taking care of you, and have them converse and see if there's a fit there. So that's very important to us to make sure that there's a fit.
Well, you can't be a success if in your heart of hearts you're thinking, I hate this woman.
Yeah, and we want you to tell us that that's not a fit. Because, you know, that's not going to work.
You know.
Yeah, if there's a
there are
personality conflict.
clashes, you know.
Sure.
Yeah.
That's just the way it is.
And like I said, I have not seen that. I mean, I'm sure it's happened. It's the real world. But I haven't heard about anything like that myself. But I'm sure that that's happened where, and you might have people that, you know, that aren't happy with anyone because they're getting the care and they're still a little. But you got to have the right caregiver in there that with that compassion and that patience to help them to understand that this is for your best interest. I'm here for you.
Patience must be such a big part of the whole scenario.
Yeah, and we're very careful at who we select to be caregivers.
Yeah.
You know, they have to have that client-centered and family-centered focus in order to be hired in the first place.
Now, do you have any male caregivers?
Yes, I knew you were going to ask that. We do. I haven't met any, but I have seen, when I go into our program and look, I have seen male caregivers assigned to male clients.
Yes.
Yeah, and they can make that happen to make sure if you're not comfortable with a female that, you know, bathing and dressing, they might want a male in there to do that. Absolutely. Yeah, that is an option as well.
Mr. Ash has slipped me a note, and on it is respite care. Tell me a little bit about what you can say about that.
Well, respite is where, again, someone else is caring for the loved one, and they might need a break. They need a little respite. You know, just a break away from the norm, because it does for families, especially like my age, 55ish. You know, they're still out working full time. They might have a loved one that's failing, and they feel badly because they can't be there to take care of them themselves. They have to work, and it's hard to have that peace of mind knowing that that person walking through the door is someone they can trust. So we make sure that the family's involved in that, you know, in the choosing, and they feel comfortable with the caregiver as well. You know, so we want to make sure that everybody has peace of mind and knows that that caregiver, you know, is not going to come in and sit on her cell phone all day. That's not allowed. You know, she's going to come in and do what she's supposed to do. She has to follow that care plan. If she's not following that care plan, that nurse steps in. That oversight is right there. I haven't heard of that happening with us, which is, let's knock on wood. They know before they go into those homes what is allowed and what is not allowed. I mean,
do
it's
they
just
have
very,
a check sheet then? The actual caregiver that will go into the home?
Yes, they have on their phone. They can pull up that individual's care plan that nurse has created. This is what I want you to do exactly in the home. This is how I want you to do it. Their personality things, like what they prefer, what they don't prefer. They don't like salt in their mashed potatoes. She'll put everything in there from that assessment. How she's very
right
thorough.
To the nitty-gritty.
She's very thorough. And our caregivers too. We have subject matter experts come in and train them. We'll have nurse practitioners come in and train them on some of the clinical side. They don't do medical care, but to know what to look for. We have dietitians come in and teach them how to not only cook healthy meals but restricted meals. Some folks are on restricted diets, so they have to know how to cook those meals. So we provide that training as well. Our caregivers don't watch any videos. Everything's hands-on.
This is an all-encompassing service that you attempt to provide for your clients. How big is your area, geographically, your area of coverage?
We cover 26 counties in Illinois. We have 3 counties in Missouri. Actually, CareLink started in 1999 down at Quincy. A couple of nurses started that business, and when they let that go and retired, Christian Homes at the time picked that up and spread it out over 26 counties in Illinois. They were already licensed in 3 in Missouri. They go into Missouri just a little bit down there, but we cover a lot of counties.
But the cost, it would seem, on the surface of it at least, employing your services would be far less, I think, than being in a nursing home per se.
Oh yes, and if they do end up in that very extended care, like skilled nursing, they have to. Medicare doesn't pay for that. Medicare does not pay for that. You either have to have long-term care insurance or pay for that out of pocket, or spend down and get on Medicaid. Spending down requires you to sell off your assets. Folks don't want to do do. They will leave their home for their children. Things like that. So, there's great advantages to prevention. I look at this home care as a prevention, just like you have a diet plan that you've went over with your doctor. You have an exercise plan. Home care is another preventative to stay healthy and independent. That's another thing. Our caregivers will go out if you're doing outpatient physical therapy, if you have that. Our caregivers will go out and watch the physical therapist go through your routine and help you do that in the home. Help you follow through with the exercises you're supposed to be doing.
Good.
Take your medication reminders. You're supposed to be taking this pill right after lunch. That's all on that care plan. So very detailed, in-depth care. To make sure that nothing happens in the home while we're there, to make sure that they can reach out, the families can reach out to the nurse 24/7 even if we're not there.
See, that's the thing that you're furnishing to families, not alone just the patient, the client, so to speak, but the families of those folks whom you serve have got to have a very good feeling about the fact that their loved one is getting the ultimate in care insofar as being at home is concerned.
And that they know what to look for. They know what signs and symptoms to look for to bring that nurse into the picture so that she can contact the doctor and catch those things, nip them in the bud before they progress into something that will take them to the ER or back into the hospital. We want to reduce that.
My family and my in-laws were all in Minnesota, and I'm down here, so I wasn't any help to anyone. And surely it must be a gift to the family when somebody who's responsible, who knows what they're doing, comes in. Because that kind of scenario, a couple of generations ago, a family stayed in the same town for eons, but now it's not that way anymore. And it contributes to the gift that keeps on giving,
Right.
Yeah.
And we all know in our youth, we've been exposed to families who had somebody at home, Aunt George or Uncle B or whatever, and there they were, lingering existing but not living.
Right, right.
And a burden on the family and a burden upon themselves. Such a thing as we discussed this morning, not available at all. And thank God for nursing homes the way they exist today, because we had none of that at those times.
Right, right. Yeah, and there is that, those community, those CCRCs, so to speak, where you can age in place. The independent, and then if you need more help, you go to assisted. Then
yes.
And you can stay where you're at. Those are nice. And some folks, don't mind that. They welcome going into an assisted living. But like I say, if they want to reach out to us in the meantime, because a lot of times they're on a waiting list. So they might decline in the meantime and want to make sure they stay healthy till they can get in there. But most folks I've seen, they want to stay home. They want to be in their home. And some folks get into assisted living and might deplete their funds and want to move back home. I've seen instances where they'll contact us to have a caregiver come in and help them. They haven't been in their home for a while. Come in, can you help me clean the house? I don't have a car anymore. Can you help me move my stuff back to my house? Can you clean my home? Make sure we have groceries in the home. That's another thing. We can go into the hospital if someone has been in there for a few weeks or a week even. We can go in with and make sure that fridge doesn't have any expired food in it, that the laundry's done, the house is clean. Everything's in place for that person when they get home, to make sure they're not eating food that has been, in there a while, and make sure
that can happen.
Yeah, and that can happen without thinking of it. We don't want them eating that food, So there's things that we think of ahead of time to make sure that they're going to, get the nutrition they need, the rest they need, the exercise, and that family is educated on what that loved one is going through and what they need to do to stay healthy. So it's all of a great big circle of care. We involve everyone, their physician, any of their doctors, family, friends. We'll involve everyone that we can and educate whoever we can, so that when we're not there, they can do those things with more confidence. Yeah.
Gaileh, we've appreciated your time this morning.
Well, I appreciate you having me back.
Very knowledgeable about a subject about which most of us know absolutely nothing. Ignorant as to the fact that we had this service available for us. A godsend for people who are in that category. We appreciate very much your being with us this morning.
Well, thank you very much. Thanks for having me.
We don't want to be trite, so we're not going to close with any particular comment this morning because it's a very deep subject. And thank you very, very much, Gaileh Barrow.
Thank you. I appreciate it.